Okay. Hi, this is Adam. Today I'm going to teach all of you DNS, dynamic neuromuscular stabilization. So this is a therapeutic technique that I learned when I was in school, and then I got really interested in the concept, and then I just started to learn. I started learning by myself, and then today's lesson is gonna be focused on breathing and core stabilization. Okay, so the objectives today include we're gonna identify key structures related to core stabilization, and we're going to identify and compare optimal and suboptimal core stabilization strategies. And then in the end, we're gonna try to incorporate DNS concepts into rehabilitation, into our day-to-day rehab with our patients. So dynamic neuromuscular stabilization is a concept developed by Dr. Kalaj. So that's he's from Czech Republic. So he has this idea to this developmental kinesiology, and to use this concept to do rehab with patients from different populations, right? So I sent all of you the videos, right? And
Yes.
then, so first, I just want to ask you, what are your thoughts on the video on DNS as in general, and then we can talk about the principles of DNS. So, does anyone want to start?
I was uh, taken back to grad school at IU, and uh, the person who did some of my physio X actually did his PhD in this idea of developmental kinesiology. We'd always go back to babies crawling, and I thought, oh my gosh, I hear, but it's so true, and it's cool. But some of this idea of, especially this diagram on core stabilization, was exciting because it so made so much more sense after you see it visualized like that.
Yes. So I think the video kind of talked about the developmental kinesiology and a little bit about the joint centration, right? So, like you said, developmental kinesiology. The idea is that we follow the different stages of the of a baby's development. It's very hard to say these two words together, and but so the idea is that the way a baby like develops is the best way to develop their core stabilization, and then we instruct our patients to follow different stages of development, and then in that way we can well in that way we can train their core from the best using the best strategy, right? And then so today we're just gonna focus on core stabilization because DNS it's a huge topic, and but the fundamental part is core stabilization, right? So and then now I just want to test your knowledge on what is the core, right? So after watching the video and using your prior knowledge before watching the video, so I hope you can scan the QR code. Maybe I should move this a little bit. Uh,
We're good. We can scan it.
can you see my screen?
Yeah, we can see your screen.
Okay, perfect. So we're seeing a lot of muscles, right? We have our abdominal muscles, right? and then we have the lumbar-pelvic hip complex, right? And then, and also remember that we also have the joints, the hip joints, the ISI joints, and then the pubic symphysis. And also remember from the video, it talks about the nervous system, right? The relation between structure and function, right? So the video used example of like of a child with cerebral palsy, right? So if there's something wrong with the nervous system, it's going to change the muscular functions, right? And the function is going to affect the structure, right? And then in return, the structure also affects the function, because if you have a distorted structure, then you're not going to function use your body parts in a normal way, right? Let's go back to. So this is the muscle that we're talking about. And then, so today, I'm just going to focus on the diaphragm, which is the driver of core stabilization. So if we look at our diaphragm, and then, so the way our diaphragm works is that when we contract our diaphragm, the diaphragm descends into the abdomen, and it compresses the abdomen, and then increases the intra-abdominal pressure, which so the body uses this increased pressure to stabilize our spine, the lumbar spine, right? So now I want to ask all of you, have you ever had any experience with like breathing techniques or breathing training, like in your with your patient population? Things like PRI or
I had a
and
preceptor that used diaphragmatic breathing at the end of our weightlifting sessions. We would end with that. Other than that, not really.
so did he use it as like a relaxation technique or like a activation technique? Do you
Kind of both. Because she was a strength and conditioning specialist and an AT, so she did like everything for them.
nice. So that brings us to the two functions of our diaphragm. So according to DNS, the diaphragm has basically two functions. The first one, obviously, is the breathing part, right? And the second part is the role, the core activation. So the diaphragm needs to work in an optimal way in order to have optimal core activation, right? So that brings us to the relationship between task uh, and core activation strategies, right? So imagine when you're doing heavy lifting, right? Say you're bench pressing like 300 pounds, right? And then you naturally hold your breath, right? That because during the 3 seconds of the sticking point, right? The heaviest point, you do not need to breathe. So so you're only utilizing your core activation function of your diaphragm. So 100% of the diaphragm like goes to core activation when you're doing a very heavy lifting, right? And then right now, right, we're all sitting in a chair, and then we're not doing any lifting. So the diaphragm, like 90% of the diaphragm, the it's for breathing, right? Only like probably 10% just to stabilize your core to keep you upright, right? So the way I see this relationship is that the athletes, right? So the athletes were like for our patients, no matter what their activities are, right? So we move from one extreme to another. We exercise, we move, we live in this spectrum, right? So our diaphragm needs to be able to work like almost all the time, like simultaneously to perform these two functions. So, and then that brings us to, hold on, this is not, so that brings us to core stabilization strategies. And now I want to ask you, how would you identify a core stabilization strategy? So what is to you a bad core stability in our patient population?
Is that a bad core stabilization strategy?
Yes. So I'm giving an example. So when you walk into the gym, or to go see a lift, or when you were doing rehab with a patient, right? How can you tell that patient has a bad core activation or a bad way to stabilize their spine? Or what are some signs, or like what are some signs that you usually use to make that decision?
I mean, they stop breathing, for one, or two, like if they're trying to balance and they can't really find their center of gravity at all, like they probably have some core stabilization issues.
Good, good. Anyone else?
I was going to say, expanding on what Kaylin just said, that between every motion, they have to reset. They can't maintain any contraction for any length of time.
Yeah, that's good. So so one thing is they stop breathing, right? So that goes back to the task and strategy, right? So say you look at this guy, he's doing dead bug, right? This is now like lifting 300 pounds, right? So like so he should be able to breathe while doing dead bug, because this is now like a heavy lifting situation, right? So which means his diaphragm can only, like, he's using 100% of his diaphragm to stabilize his core. Well, so from my own practice, so when someone stops breathing, when they're like bench pressing like 50 pounds, that's a sign for me that they're not really like they're not using their core in a very good way. They're trying to compensate from their diaphragm, that which takes away their breathing. So another way for me is that they're unable to touch the floor with their lower back, right? So remember from the video, do you remember the open scissor posture, right? So the diaphragm and the pelvic floor should be parallel, and then for some for some for people with the lower cross syndrome, right? So so the so the diaphragm and the pelvic floor, they form an angle, and then when they try to move their hips, say if they're in a dead back position, right? So their hip flexors kicks in to stabilize their lumbar spine, and then which forms an arch, the lordotic arch. So that's why they're unable to make contact with the floor, to the floor with their lower back. And then also you can see this guy, he's lifting their head, his head from the floor, which adds tension to their posterior chain. So because athletes, right, they're very goal oriented, right? If you tell them, hey, you need to touch the floor with your lower back, so what they would do, they would lift their head up so that they have more tension in their lower back so that they can touch the floor, right? So that is like very obvious sign for me, because they feel they're really crunching their abs really hard. They feel they're engaging their core, but they're just, to me, they're just using their rectus abdominis instead of their PAs or internal obliques, and obviously their diaphragm. Right? Does that make sense? Right? Um.
Yeah,
Yes.
question for you, Adam.
Yeah.
So with that, what if somebody has just excessive lumbar lordosis from like a muscle spasm? Like they're still firing properly, it's just a muscle spasm that's causing lumbar lordosis. Is it, would you consider that different?
Yeah, yeah, obviously we all have different postures, right? And then I would actually go for the reason why person is having a spasm or a lordotic lumbar spine. And then is it from their hip flexors or is it from their hip joints, right? There are a lot of reasons. And then I think from a DNS perspective, unless we can address the root cause, maybe it's a TED hip flexors, right? If we try to release the hip flexors, can we change the body posture so that the patient can perform a core activation in a better body posture or in a better environment, right? So yeah, I'm sorry, I probably don't have a very good answer for you right now, but yeah, I'm still trying to figure this out for myself. And yeah, and now I want all of you to try to activate your core, and by practicing ourselves, we can then try to teach our patients. So this is very easy because even though we have developmental kinesiology, but there are no DNS exercises. There are only DNS concepts, which means we should be able to perform core activation in any position, right? So we're sitting right now. So we're what we're gonna do, we're gonna sit upright and set our pelvis in the neutral position or whatever feels neutral to you, right? And then we're gonna take our hands and then we're gonna put our hands around our waist. So the four fingers in the front and the thumb in the back, right? So you can feel when you try to breathe, right? When you breathe in, I want you to try to push with your abdomen against your hands, but push out like laterally, like this way, and also a little bit forward and back, right? When you breathe in, I want you to push out against your hands. And then when you breathe out, I want you to maintain the pressure against your hands, but also you need to be able to breathe out. Or like holding a breath, then you're not doing it right. But so the point is we need to be able to breathe and then have the core stabilization. And then put your hands back on. We're gonna progress just a little bit and see if there's any like challenge here. So put your hands back on and then start breathing, right? And then you're going to lift 1 foot from the floor, right? And then I think that changes a lot, actually, just a little bit imbalance, and then it changes, like it's like very challenging for some people, right? And I know you're all doing great, right? But you know, that's a very easy way to progress for our patients, right? Just by lifting a foot from the floor, or you can do some upper body exercise while checking their core activation, right? So yeah, this is how you do it. This is how to activate your core for any patient population. For do you have a question or just yeah? So this is a DNS concept. We can incorporate this concept into any rehab exercise, like whatever you want. So does anyone have like questions or have an idea of how you can incorporate this idea into with your patient population? Because I work with college athletes, but maybe for like elder population or for kids, right? So
Just having them be aware and talking to them about it and making them model that when they're doing some. I've got two doing ACL rehab right now that I'm smiling because I think this would be a nice way to challenge them to think about something else while they're doing the repetitive materials. Yeah, thanks for this idea.
Yeah, and if you want more information, you can scan this QR code that leads you to a my favorite YouTube channel, and then he only has like 10 videos on DNS, so he does very good instructions, much. So the last thing is course evaluation, and then I have some questions, and then can do the course evaluation, and then I think that's the end of my my lesson on the